Welcome back to Digital Doc Games, the channel about everything games and health. If that sounds interesting to you, make sure you like this video, share, and hit that follow or subscribe button so you can best support the channel and never miss new content. I've been so overwhelmed by the recent support for the channel, and just know that every single new subscriber or comment fills me with so much joy and gratitude, so thank you for being here. Today, I am joined by Lucia Pannese, expert in gamification, VR, and serious games. Lucia is the founder and CEO of Imaginary, one of the longest established and most respected European serious game companies designing games for health, training, and education. Lucia, thank you so much for joining me today. How are you?
I'm fine. Thank you, Amit, and thanks for having me.
Absolutely. I'm really thrilled to have a discussion today to learn from your expertise. Go ahead and tell me a little bit about yourself, Lucia. Tell me about your background and what, really got you interested in serious games and games for health to start.
Yeah, thank you. So I'm a mathematician by background, and I always worked in digital companies doing sort of, say, traditional digital approaches, which in a way were always a little bit boring. So what I thought is that what we needed was to renovate a bit the approach and keep the user more active. So being a mathematician, I was always thinking of the simulation side. So if you simulate stuff, you can experiment complex environments, understanding the logics between bits and pieces and figuring out what you have to expect and so on. So that brought me closer to the game side. And then lately, then the more creative side of games came into being. So when I started my company 17 years ago, I thought that users should be able to simulate in an easy way, in a simple way, in a creative way, and being able to experience. So experience was one of the main aspects that was important to me. And it was the time when serious games were born in the US. So the movement came up. And at the same time, we had a similar idea. So it was quite natural to pick it up.
So it's interesting. It sounds like you found sort of serious games more from looking for that angle of how can you get your user more engaged. Did you have a background? Did you play games growing up? I mean, how did you know to look there?
I wasn't never the real gamer in the strict sense. I love to play games, but it's rather games like when you play tennis, when you play volleyball,
Right.
rather sports games. And I need movement. I need a sort of excitement even in the physical sense. So moving around and being with other people. But it was the idea of course, being able to deliver something that keeps you engaged anytime, everywhere, although it sounds a bit, dull and already heard. It was the time when e-learning popped up, but that was also not convincing to me. So I really needed the sense of being able to deliver some experience, when reality is not available. For example, imagine even trainings for civil protection or police when floods come or things like that. It's a bit difficult to recreate. So it costs too much. It's not there. You need maybe long times to check data and outcomes, and you need to shorten that if you need to experiment and be able to plan strategically. So how to translate all this into digital, and actually with games and with sound models behind the lines, it's a good approach to do it.
Right. I think that's great. I think it's very exciting for me to hear. I hear a lot of stories about people who were gamers or game developers more in that world who are like, hey, no, kind of a little bit more like me. I'm sort of in the middle, but there's something more here. There's something more to this medium. But it makes me excited to also hear stories, from people like yourself, Lucia, who come from the other angle, which is more on the science, more on the education, more on that background, and be like, no, we need something to connect the user, to engage them more. So that's great to hear. So Imaginary, your company, has created, at this point, you said 17 years old, has created so many games that are worth talking about. And honestly, we could dedicate entire podcasts, and maybe we'll do that. We'll take deeper dives.
Okay.
But if you take a look at the Imaginary website, which I'll make sure to link in the description of this video or podcast, you'll see there's educational games for kids suffering from intrusive diseases like Crohn's or cystic fibrosis, to more clinical education games for healthcare professionals like a resuscitation game or injection simulations. Lucia, what is it like creating these games that can be so heavy on clinical content? And how do you, as a development team, go about a process of ensuring these games are designed to be medically accurate or purposeful for the educational content that you're trying to get out there?
I think the main ingredients that you need here are two. One is the right team for it, and the right team is necessarily a multidisciplinary team. So what we have in-house is a team made of psychologists, game designers, a whole series of technologists, of course, training experts, and so on. What I mean here is the ability and the competence to having a sort of overall angle to the whole story here. And the second ingredient, and I'll come back to the first one because everything is linked, of course, is the access to specialists, so medical specialists, as well as the patients.
Right.
But then again, if you have, and I'll tell you how we do that in a minute, if you have these two channels of access, then you also have to know how to talk to these people, how to ask these people, how to understand the scientific background or the needs, the concrete needs, as well as the motivational triggers that then keep the patient into, for example, adhering to a therapy or understanding what you're trying to convey. So it's not only having the access, but also, I mean, if I had only technicians, it would be a bit difficult, honestly, with all respect for technicians, because we need them, of course, a whole range of different competencies, but they're not the right people to work together with medical specialists and patients. So this is normally the psychologist. So he or she is the link towards the scientific side of the team. Of course, it's a psychologist in this case, who is a researcher with PhD and research experience, who links to the medical team and who is able to involve the patients into participatory design activities, which are the concrete activities that allow you to co-design, in the real term of the word, meaning of the word, a game with the patient. So the point is not that you want to have the fancy technology, the fancy graphics, or you have the cool idea for a nice game. No, this has to come from the patients. Of course, in full respect of the medical and scientific background that you have to preserve. So it's a truly complex piece of work that goes through cycles. So the medical investigation comes first, then you pass through a motivational analysis with the patients, then you start prototyping very lightly, going back to checking the science, going back to checking motivation, starting with a prototype that is working, and then you cycle again until you can then validate and so on. And the way how we can do this is that since the very beginning of the company, we have been involved heavily in European funded research. So this means that we participate to quite large research projects that each takes 3 to 4 years, for example, on one specific topic, which has clearly a sort of global impact. So pathologies that are the same everywhere in a way. And we have had the access to patients and specialists through this European research, because it's a little bit difficult, specifically for a small company with no strong brand, to just go and finding patients that can work with you. So that wouldn't be working.
Sure. So, Lucia, Rehability is the new game-based system that Imaginary is working on. And it's a physical and cognitive rehab for patients with neurological deficits like stroke that uses a Kinect-like camera as its controller interface. Tell me about where the idea for Rehability came from, and what has it been like creating a game designed as a therapeutic?
Yes, this is our flagship product, and we're very happy because 8 years ago, actually, we've had by chance the luck of winning a European proposal, where the title was Rehab at Home, and it says it all. So the idea of the commission was that we have, of course, increasing number of chronic patients everywhere. Number of specialists are constant, if not decreasing, but even if they're constant, of course, they cannot cope with the huge request that we have. So therapists can never be optimized for these kind of patients, because you can treat them for a bit and then you have to let them go because you have the others needing you. But if you could continue to monitor them and support them, therapies would either slow down in case of degeneration, or the improvement could increase in case of post-acute things like a stroke, for example. So that was the idea for trying and identify how a system for telerehabilitation should be designed. So we started this adventure 8 years ago with this first project, and the choice fell on neurology and on specific kinds of pathology, so post-stroke MS, Parkinson's, and then we had also spinal cord injuries later on added to it. And there again, we designed the game, so the exer game, if you want to call them like that, plus the cognitive stimulations in the games. After the end of the project, we continued to engineer the solution. We added trials and we added validation and so on. So right now, what we have 8 years later is Rehability as a system. Imagine a container that decouples the work of the specialist and of the patient, so that the patient can be even at home, but you can set up personalized therapy plans for each patient and clearly monitor them, so you have a rich analytics area. And yes, the idea is a Kinect-like camera, so an RGBD camera, which is reading the patient's skeleton. So the patient can move without the need of wearing anything, which costs, which is maybe complex to wear, or you have to recharge stuff. So it's super simple. You just stand in front of the camera and move to interact with the game. And the specialist on the other side receives a lot of detailed feedback, which he or she can reconnect to your impairment.
So this designed to be something that is used as an adjunct to in-person physical therapy, or could this be something that's standalone?
Well, normally the therapy starts at least for a couple of sessions with the therapist, so that the therapist can set the rehabilitation pathway really finely tuned to your needs, and then it can go on as a sort of follow on for as much time as you need.
Sure.
Yeah. What should be specified is that the Rehability Neuro is already a medical device, so what we said now. And in the meantime, we're working on other content, so the cardiac version, rare diseases, and so on, because each pathology group needs, of course, special exercises, but also it's not only that, it's also that the kind of patient changes, and different kinds of patients. And I'm not only thinking of age, but really of the conditions. These change your motivation. So if you co-design games with the patients, and patients are different types of patients, you need to really check that their motivation is preserved. Right. So you need different kinds of games.
Absolutely. Absolutely. And I love the idea that this is something that can be started as an adjunct in person, but carried on afterwards. I mean, at least in the US, let's say neuro-rehab for post-stroke, only lasts, I think usually
2 months.
Yeah, 6 to 9,
8 weeks.
Right, to 9 weeks maybe.
Yeah.
So, and you're only getting it on average maybe 3 times a week. So there's certainly room for flowering in other practices at home. So I think that's really great. Something very important that you added on there is that this is a medical device.
Yes, it is, because we have scientific literature. We have 22 scientific publications already behind our backs, and there are some more coming. And one of the very super exciting things is that with this neuro version, one professor, one neurologist here in Italy, he was treating COVID patients recently. Of course, COVID was not included in the studies because we didn't even have a clue it would ever exist in our lives. And unfortunately, it came to being. So he treated them. He got very good results, apparently. He collected data, and he's about to publish the first paper about that.
Wow. That's really exciting. And, I have to ask, on the design side, physical rehab is obviously, like you mentioned, an area primed for innovation. There's a lot of room for tele-rehab protocols and technologies. And you mentioned sort of the issues that we face as a system, as patients, with adherence to rehab practices that games can certainly help with. Why did you decide to use a Kinect interface for something like this versus maybe something more immersive like virtual reality, maybe more accessible like a mobile phone? Why was that RGB camera? Is that what you
RGBD.
RGBD. I missed the D. Why is that the right technology for this?
We believe it's the right technology for a broader range of patients because, for example, elderly patients would never use a smartphone. First of all, it's too small. And then for moving in front of the smartphone, I mean, I wouldn't even use the tablet. It's too small. It's not motivating enough. You're not feeling the immersion. You're not feeling it's not seeing you as a whole person, even in terms of joints and so on. So VR, on the other hand, is surely interesting and exciting, but it has a lot of buts. One is medical. So imagine an elderly person after a stroke or something degenerative with a headset and immersed in another environment. And how would it easy to fall? So what we have to avoid is falls, for example, and it would be really easy to throw them down. So it's something that is not viable. By the way, it costs too much. Because if you think of sending patients at home, you need something which is super easy to use, but also quite cheap. And if you need a headset needs a PC, and it's a good PC, so a PC that costs a bit.
Sure.
So you need to know how to switch it on, how to handle it. You always have the risk of some nephew or somebody quickly installing something different which might interfere.
Right,
so this
right.
no one.
Yeah, you're trying to play your rehab, and all of a sudden you're like, why am I playing,
Yeah, exactly.
Call of
Something
Duty in
different.
VR?
Exactly. So we have home kits where you cannot install anything. It's a super tiny set-top box with a little camera that uses your TV screen as a screen. So it's very easy. It's quite cheap. They only need the remote control, switch it on, and on the big screen they have their personalized rehabilitation therapy. So it has very many advantages. So we really believe this is a good solution.
Yeah, absolutely. And you mentioned something important with the VR and needing to be mindful of your design. These are your players, your users, your patients are going to be older populations who, first of all, need to understand and be comfortable engaging with the technology, but also there's a risk of falling, like you said.
Yeah.
For Rehability, I mean, even with the RGBD camera, there may be activities, I would imagine, that these patients will need to engage in that, maybe if they're post-stroke, for example, it may be difficult for them to lift an arm in the way that they might need to.
Yes.
How is that designed for?
What we have is a so-called calibration, which exactly for the upper limb, it means that at the very beginning you measure the range of movement of the limb that you have to treat. And this is being stored, and immediately all the games are resized in a way that even if you have a little bit of movement like this, you're able with that to reach the whole screen.
Okay.
Because we are really working towards a motivation, while it would be really frustrating if you couldn't play or get your scores because you cannot reach things that are maybe on the larger side or the edges of the screen.
Yeah, yeah. And that's amazing. And sorry, I didn't mean to cut you off. I was just gonna again say, so great to hear, and so key for a product like this to be thoughtfully designed, because again, every user is going to be using this differently based on their body's abilities.
Exactly. And then there's also another trick that is a parameterization of a lot of variables in the games. So it's up to the therapist to really tune each single game for each single patient. So in other terms, the same game for you and for me could be quite different in terms of spaces to use, of number of elements, of speeds of the elements, of distracting elements, of maybe semantic categories according to the cognitive side as well. So it's more difficult to say than to tune, because if you're a therapist, you know what you need to do. So with easy drop-down menus in the what we call doctor station, you can really set every single game in really a fine-grained shade of difficulty, if you want to call it like that, for the single patient. They can stand, they can sit in front of the games, so interacting while sitting, even in the wheelchair. And what we do normally is we deactivate those parts of the body which are not supposed to use. So if you need, say, to train the right arm and you want to trick out the system or your therapist and try to use the left arm, it's not working.
Right.
So you really should use the right arm or leg, whatever. But there's quite some studies behind.
Yeah, it sounds that way. And I just wanted to throw in that, Lucia was kind enough to share a trailer actually that we should have, by the time this interview goes live, posted on YouTube. So if you're watching on podcast, make sure to head over to youtube.com/digital.games and check out that trailer for Rehability so you can get a better sense. And Lucia, I wanted to ask, you've mentioned a couple times some headway you've made in Europe, in the market there. It sounds like there's a lot of research opportunities, grant opportunities. You've classified your device as a medical device that I'm sure helps with going to market and reimbursement. How is the adoption of digital therapeutics in general going over in Europe? Is there a path to market for digital therapeutics?
I think there is. And actually, we must say, although there's a sad side to it, of course, that COVID was speeding up a lot of processes of things, opening up a lot of heads, honestly, because there were far too many people thinking this all is interesting, but you have to change processes, you have to change the way, so it's never straightforward.
Right.
And then, of course, there are things like reimbursement policies, which clearly were not in place. I mean, it's starting now, so everything was starting to speed up, due not thanks, but due to COVID.
Sure.
Now there are several centers starting this adventure, so they maybe start as a sort of research project, or they want to see how to get organized, which is, fair enough, because internal processes need to be put in place clearly. So no clinic knows straight away how to deal with remote patients, because this has never been done before.
Right.
But there's a lot of interest. There's also public openings for studies, for trials, for solutions. Everybody's trying to find out what we have already, what we can do. So there's a lot going on all the time. So it's really exciting times.
Wow. It's so interesting. I am so excited to see all the success Imaginary and Rehability is going to have. I think it's a fantastic game, a fantastic health solution. So really congrats on that. Before we ended, Lucia, I wanted to make sure to ask you, I know you said you're not a serious gamer in the traditional sense, but I have to ask if you have any favorite games or recent games that you've played anywhere, whether it be on mobile, at a nephew's house, or even one of the Imaginary games, anything that stands out?
Well, of course, our games I like, but in a way, they're not always designed for me,
Sure.
The point is not I should like them. It's our target group who needs to like them. And this is absolutely fundamental. So I never want to put a bias in our games, because it's not me needing to like them. So, I'm a bit the old one. I prefer to play tennis, honestly.
There we go.
But it's not digital, I know. But, I'm in front of a PC all day already. So then I need also a little bit of movement.
That's right. Yeah, I should really learn from you, because I need to. I love settling into the remote life. It works for me. It's a nice, I got my screen set up, I got my station, everything works. But the one thing I haven't, and it's not good, because when you have an MD after your name, I think you should be living by example, and I need to get out and do some more outside exercise. So you'll be my inspiration, Lucia.
Sports and animals.
There you go. Awesome. Well, Lucia, thank you so much. Anything else you wanted to take this time to share with the Digital Doc Games audience about yourself or Imaginary?
Well, I'm very happy to having had this opportunity, of course, and we are very open for collaborations. Maybe we could say that. So, for example, also for the new versions of Rehability, the cardiac one, but also pulmonary or orthopedics, rheumatology, and so on. We're very happy to get in touch with medical doctors and clinics who want to cooperate with us. So trying what we have, sending suggestions for the new therapists and so on, and then maybe publishing something together. So this is always very interesting for us.
Absolutely. And if someone does want to get in touch with you for a collaboration or even to see what you guys are up to, what's the best way to do that?
Either via email. I always check my emails, even if I'm away, or they can find me on LinkedIn, but email always works.
Awesome. Awesome. Well, Lucia, thank you so much for being here. And thank you so much, listener, for taking the time to tune into Digital Games. If you want to continue the conversation with myself and some more truly fantastic people, you can find the link to the Digital Games Discord in the description below. If you liked the interview, please remember to drop a like and comment or review. And remember, for all things games and health, keep it right here to Digital Games by following or subscribing to the channel. Thank you so much, and game on.